If you see an adult person suddenly collapse, check the scene for safety and check for casualty responsiveness. Establish whether the casualty is conscious by gently tapping him on his shoulder and shouting, "Are you okay?" Call for 108. If the casualty is unresponsive with no breathing, immediately call 108 or ask someone to call 108 for medical aid. Care should be taken not to give anything to eat or drink to the casualty. Perform ABC evaluation test. In case of any casualty, ABC evaluation tests have to be followed in order. A. Airway, that is, clear the airway. B. Breathing, that is, check for breathing. C. Circulation, that is, check for circulation pulse. Please remember the acronym of ABC to perform the evaluation test. A. Airway, clear the airway. In an unconscious casualty, the airway being blocked is a usual suspect. The casualty could have vomited and particles could obstruct air from getting in. This can be cleared by finger sweep method. Before doing this, you could tilt the casualty's mouth to one side and use your index finger to sweep for foreign particles from the casualty's mouth. Another reason for airway blockage may be the casualty's own tongue could obstruct the airway. This can easily be cleared using the head tilt and chin lift technique. To open the airway, use the head tilt chin lift technique. Press down on the forehead with one hand and lift the chin upward with the other hand. In this technique, when the head is tilted back, the tongue is pulled away from the back of the throat. Now the airway is open. B. Breathing, check for breathing. After opening the airway of the casualty, then check for casualty's breathing. By placing your ear over the casualty's mouth and nose, look for rise and fall of the casualty's chest. Listen for sounds of breathing and feel for breath on the side of your face. C. Circulation, check for circulation pulse. If possible, try to check for a pulse in an unresponsive casualty. The place we want to check for the pulse is the carotid artery. Tilting the head back and lifting the chin up, place 2 fingers on the casualty's neck, 2 inches to the left or right from the Adam's apple of the casualty. The time you want to check for a carotid pulse is not more than 5 to 10 seconds. Don't push too hard. If you push too hard, you will be unable to feel the pulse. Gentle pressure is just enough to feel the pulse. It's important that never check the pulse with your thumb, because by checking with your thumb actually has its own pulse. Carotid pulse is recommended as it is closest pulse point to the heart and easier to detect than the radial pulse. If you ensure that casualty has a pulse and is breathing okay, put the casualty in the recovery position and check with 108 for their arrival. Else, seek nearby hospital for medical aid. If the casualty is found breathless and does not have a pulse, then you can start to perform CPR, that is, cardiopulmonary resuscitation, by applying the principles of CAB.